Okay, so we're going to do the same test we just did, all right? This is called the piriformis test. Yep, and I'd like you to relax as much as you can. Yeah, relax even more, that's good, great. So now I'm going to internally rotate your femur. Yep, relax even more, let your legs just fall. Here, I'm holding onto your legs, let them fall down toward the table. Yeah, and as you're starting to relax, I'm starting to see a difference in range where this one has about 40 degrees range of motion from midline, and this one has about 55, 50. So there is a difference. Does it feel different in the hip joint?
Yeah, I'm noticing it.
Okay.
I noticed that my right was tighter than my left, even though the left is where I had the surgery.
Your right is tighter than your left?
Yeah.
Okay.
Isn't that what you would say?
That's what it feels like to me.
It feels that way to me too.
Okay, good. And so you're having the symptoms on the side where you have more internal rotation, and more internal rotation generally implies a difference in the alignment of the hip joint on this side, in this case the left, and it also implies that the lateral rotators, which do this and which control this motion, are inhibited, inactive, or commonly called weak. So that's what I would recommend your PT
which side is
to
this?
work on. This side, the problematic side, the left side.
Yeah.
Yeah?
Uh-huh.
So you may not be able to see this from where the camera is positioned, but your whole back from about here on down, your low back and your pelvis are twisted over towards the left like that. And when I feel your spine, it feels to me like right around the third lumbar vertebra, right there, there's a significant torsion where that vertebrae twists over toward that side. And I think these feel rather straight. These feel like they're in line with each other. And this one feels like it's twisted over toward the left.
It's my third lumbar.
That's what it feels like to me, yeah. 3,
It's twisted to
4,
the
and
left.
5. Yeah, it feels to me like the third one is going this way. And these two are straight, like that. The second one is also twisted just a little bit, so it's like this. So the whole thing is twisting over towards the left. Right? The implication for me is that you probably stand on this side, post on it a lot.
It could be, but I don't have any idea.
Yeah, that's just my theory.
Yeah.
Okay, all right. So that's the first misalignment that I think has to be addressed. And even if you, at the age of 77, can't move these bones back towards neutral, you still can work with the muscle tone on each side and your range of motion and your strength and your flexibility on each side, and that'll create a functional correction, even if there's no anatomical correction. Okay, so that's the first thing. There's definitely strength or muscle shortening on the left, which is not there on the right. My fingers feel some resistance on the left when I press. This is all on the video for you. And on the right, they just sink right in. There's definitely a difference in tone. There's definitely a difference from where I'm standing. Okay, and then the SI joints, right? So I'm looking at the hip bones. So I'm looking at the SI joints, and I'm using the hip bones to measure the alignment of the left and right SI joints. Now, if I look at this prominence, it's not quite the PSIS, but below it. What I see is that this hip bone is rotated a little bit more forward, like this. And this one is rotated back. So you have this dynamic happening. You feel what I'm doing there? Yeah. This one is going back and this one is rotating forward. Do you feel that?
Yes.
Okay. So.
Yeah. Understanding what you're saying is one thing. Remembering is going to be quite a different thing.
It's all on the video for you, so you don't have to remember anything. Okay. You think I can't remember a goddamn thing these days. I'm 47, not 77. So if I hook my fingers below and above these prominences on on your two ilia, what I see is that the alignment of your pelvis is quite off. So it's like this, like that, right? This is called, I just call it torsion, but it's, you know, nutation, and contranutation is what they call it in Western medicine. And so the way that we're going to deal with that, first of all, it's imperative that when you start, that when you lay down, i.e. sleeping, laying on the couch, whatever, that you keep your legs neutral, right? You cannot sleep with your legs in like a figure four, like this.
That I don't understand.
So look over here. You see that?
Yeah.
Right? You can't sleep with your legs like that.
I've been sleeping with my legs like that for my entire life.
Right, which is contributing
I have
to
to keep
this.
my legs straight when I
Yeah.
sleep.
Yeah.
And that is a very, very difficult thing to ask me to do.
Well, would it be
changing the way you sleep? It's like I don't sleep very well anyway.
okay? Well, it's there for you if you want to do it. You know, to the extent that you do it, this will get better all the sooner.
The straighter I keep my legs when I sleep.
Yeah, neutral, not straight, right? Neutral. So
With a slight bend in the knee, that would mean.
you can bend them slightly. That's fine. Just don't bend it that much.
Yeah, I think that is what I do.
Okay, if that's what you do.
I'll try.
Yeah.
But sleeping is, that's an
Yeah.
issue of its own when you get to my age.
Yeah. Well, it's an issue for anyone. I mean, look, my first son, when he was a baby, he didn't sleep more than 20 minutes at a time. Sleep is an issue for everyone. Okay, so what I'm going to do first is put a pair of wedge-shaped blocks. These are called sacro-occipital therapy blocks. And SOT blocks were created over 100 years ago by a chiropractor. You can relax. And I'm going to put one block under your greater trochanter here so that this hip, which is rotated back, starts to slip forward a little bit. Okay, so just relax down onto that block. And then the other block, I'm going to place that above your greater trochanter, right on your hip bone, so that starts to leverage that half of your pelvis back this way, right? Because these are going like this, and now the blocks are attempting to allow them to correct that. And then if you fix your sleep position, which everyone here is successful at doing, then we should be able to meet each other in the middle. You should be getting improvement. Right, so like I said earlier, if your PT is working on the problem and you're not getting better,